So I'm now going to shift over to this presentation 2, and you may want to follow along the slides for that. Okay, so with this presentation, I'm going to talk about 3 types of modeling that are very popular within the system science area, and particularly for system science and health. All of these are dynamic modeling approaches. They're all approaches that fall into that general rubric we've just talked about. They depict a model. They involve models which depict the state of a population over time, where there's some behavior that's endogenously captured, things are generated internally, some that's specified in a pre-specified way, and they simulate the system evolving over time in a way that can be used to reason about intervention priorities, etc. There's 3 major system science modeling techniques I'm going to touch on. And they are system dynamics, agent-based modeling, and discrete event modeling in this lecture. This afternoon, I'll talk some about social network analysis. Social network analysis is most commonly conducted, not always, but it's most commonly conducted in a static fashion, meaning it doesn't depict things explicitly as they evolve over time. So I'm concentrating on those 3 that do. System dynamics, agent-based, and discrete event. I'm going to spend most of my time in system dynamics and agent-based, but because of what I'm hearing from folks about the important roles of service delivery, I did want to highlight discrete event modeling, particularly for its use in hybrid models. Okay, so what is system dynamics? System dynamics is a dynamic modeling methodology that dates back to the 1950s. It's invented by J. Forrester, who was a preeminent scientist at MIT. He was known for his contributions to what's called control theory, and he basically designed a lot of the systems that protected North America during the Cold War from to detect Russian bombers was the idea at the time. He was also responsible for some big advances in the computing field at that time, such as the invention of core memory. But his interests were consistently often involved modeling of factors out there in the world. And he created a methodology which was originally more applied to mechanical systems, but which he realized could be applied in many different contexts. And he originally called it industrial dynamics, because he applied it in a business context. But it's been applied very successfully over the years from everything from ecological issues to issues having to do with many types of health concerns, communicable chronic disease issues, zoonoses, etc. And it's actually very, very popular in certain quarters in the health area. System dynamics is a feedback-oriented perspective. It focuses on accumulations and feedbacks. These are abstract terms, and we'll get into some examples of them. But the reflection is that it turns out if you want to understand the behavior of systems out there in the world, often some of their core behavior is driven by feedback. So let's take the vicious cycle involved that we talked about earlier. Vicious cycles associated with adverse interactions between a caregiver and a baby, where it leads the baby to be respond less warmly, less attentively, and it leads the caregiver to potentially feel sort of adverse affect and potentially develop depression, which furthers to the baby's situation. And there's sort of a spiral downhill. We call that a vicious cycle, but it's an example of a feedback. A affects B, and B affects A. The mother affects the baby affects the mother. But we also talk about in the context of co-regulation. It can be turned on its head and involve a very healthy sort of situation where the caregiver responds to a baby's needs, and the baby's needs are partially met, and therefore the distress is lessened on the part of the baby. There can also be self-regulation involving a feedback within a given individual. So individuals can learn relaxation techniques or learn techniques for a baby, which might involve thumb sucking or what have you, to help regulate feelings of stress. These are all examples of feedbacks. And system dynamics focuses on feedbacks as a way to kind of understand important phenomena in the world. It's also an evolving methodology that seeks to conceptualize, to understand, describe, analyze quantitatively, and manage complex systems. It's a little bit distinguished from the techniques we're talking about here because it includes a really strong emphasis on not just quantitative models, but on qualitative models. Models that can be sketched out, that can be used to enhance the discussion with a stakeholder that you're meeting for the first time, and you actually sketch out something on a piece of paper, and they can actually understand it. It's a qualitative depiction that can be almost immediately understood by someone even walking into the room, as for an example I'll be telling you about later today. Walking in halfway through the discussion, they can understand what's being talked about, and they can contribute. Very powerful. But it also includes real quantitative components, and it built atop rich set of understandings from math that go back centuries. It includes a defined process, an emphasis on the modeling process, not just the modeling artifacts, not just the model, but that whole process is delivering value for everyone, not just for the modeler, not just because of the model built, but a model process that helps everyone think more clearly about the situation. And related to this, it involves time-honed techniques for working in a participatory way with stakeholders that I thought might be of particular interest. And I'll be talking about that some this afternoon. It has a very rigorous mathematical foundation that's amenable to sort of really very rigorous analysis that can give a lot of insight and allow for tools that are very powerful. And some very evolved software that allows you to build these models with a minimum of programming. There's almost no programming in a traditional sense involved in system dynamics. You do have to be careful to specify these models precisely, but as far as programming, it's absolutely minimal. System dynamics' traditional emphasis has been on not just building a model, but changing how people think about a situation. The idea here is that, look, when we're navigating life, models are very, very useful, but ultimately we make a lot of decisions based on our understanding, our gut feel. When we're in a meeting, we may not immediately run a model, but we'll respond with suggestions to reflect our understanding of the situation. And a lot of the failures reflect the fact that our mental understanding is sort of inadequately developed. So the idea here is to use modeling, not just the model, the modeling process to improve how we think about the world, the sort of rigor with which we think about it, and to change our mental model, to evolve how we think about it. It's very interesting. Different modelers have very different responses to this outside the system dynamics area. In system dynamics, this is sort of commonly sought. We want to change how people think about the situation. Most of the work that I do values that very much, sort of changing, bringing diverse people to the table and helping to shape how we think about things. Some modelers out there that you'll find, particularly technocratic modelers who are very into very, very quantitative models for use in policy, sometimes believe that actually it's the model that yields the most results, and they're not terribly interested in changing people's minds. So you'll find, in the spectrum of modelers more generally, a real diversity of thoughts about that issue, but in system dynamics, it's a real emphasis. And I talked about this picture before, which is very much drawn from system dynamics ideas of where the mental model, how people think about the situation, is a big issue. So what is this system dynamics? Well, here's a couple features of it. It focuses on feedbacks as the fundamental shaper of behavior. Turns out that feedback drives a lot of system behavior. If you have a vicious cycle, it's very hard to sort of pull away from that. If you have balancing loop, a situation that's regulatory, like co-regulation or self-regulation. If it's working well, it can be very, very powerful mode towards stability. And accumulation of, say, stress over time can be a big cause for inertia, delay, disequilibria. It takes time to pay off the deficit, to pay off a debt. It takes time to build up social capital. These are accumulations. And once they're built up, they continue to exert emphasis for quite some time. Similarly, like we said earlier, if you have a buildup of adverse social relationships between people, it can take years to sort that through, even with counseling, to sort of, work through the issues, that the bad feelings that were brought up, the defensiveness, the sensitivities, to get it back into a stable state socially. And those are examples of inertia, and those are examples of accumulations. System dynamics has traditionally emphasized stakeholder participation within the modeling process, a big emphasis in my work for many reasons we'll talk about this afternoon. But the models do admit to formal reasoning analysis. This is not loosey-goosey modeling that's just rough and ready sort of sketches of things. This has actually got a lot of rigor to it. And it can be applied at different levels of granularity, at modeling at the level of individuals and their relationship, or modeling at the level of a population. System dynamics can be used in many different sort of levels of detail, levels of aggregation. But a big emphasis has been participatory modeling. And as a result, it tends towards simpler formalisms that lots of people can understand pretty quickly, and that you can use in group model building sessions, where you bring many people together and collectively you actually build the model together that captures their understanding of the system, their understanding of how the system works. You may not put all the data into the model at that time, but you capture their sort of understanding about how things work. It turns out that the ways in which the models are represented facilitate that process. So one example of a sort of qualitative or semi-qualitative mechanism is what's called a causal loop diagram. And I show you a causal loop diagram here. So here I'm depicting, and I don't want to promise that all of this is perfectly correct. I'm trying to give some sense of how this can be used. So you might have some linkages here between caregiver distress and infant distress. And there can be a vicious cycle here in the absence of other factors. And we'll see how we can elaborate this diagram to show regulatory components as well. But this is an example of what's called a feedback. And it exhibits also features associated with causal loop diagrams more generally, like these linkages. So you'll notice there's a link from infant distress to caregiver distress with a plus. Now, that plus doesn't mean it's a good thing. It doesn't mean it's a positive in the sense of a normative judgment. What it's saying is that if infant distress rises, all other things being equal, caregiver distress will rise compared to the value it otherwise would have had. And this type of component is just going to be one piece of a bigger diagram. But this is depicting one influence on caregiver distress from infant distress. And there's a plus here, indicating that they move in the same direction. If infant distress rises, caregiver distress will rise. If infant distress lowers, caregiver distress will tend to lower. But meanwhile, there's also another link you'll notice between caregiver distress and infant distress. So what that's saying, and it's associated with a plus as well. So if caregiver distress rises, infant distress rises. So here we have a situation where we have two links from A to B and B to A. And what it's saying is that a change in A, infant distress, will tend to ripple around, all of the things being equal, and we'll take a look at some of those other things in just a minute. All of the things being equal tend to ripple around, cascade around to increase caregiver distress, and that can actually further increase infant distress. So that would be an example of a vicious cycle, a cycle where you can get a cascading series of adverse changes. But conversely, if you could lessen infant distress, lessen caregiver distress, further lessen infant distress as a result of that. And there's many systems like this in the world where we see these sort of feedbacks. I could create one probably in about 5 seconds with this microphone. Is anyone familiar with microphone feedback? Sometimes just hear it called feedback, where it squeals, right, in a most unpleasant way. And just as I won't, claw a chalkboard right now, I won't engage in that sort of feedback mechanism, but that's a common feedback where A increases B and further increases A. So this original change in infant distress, it led to this cascading series of changes. In this case, it's just through one variable that amplified that original change. It made it even worse. It piled on. It piled on. Whatever original change, maybe it was due to a wet diaper, maybe it was due to a sudden disturbance. The infant is startled. It exhibits distress, and then potentially it steamrolls and the caregiver piles onto it. So it worsens it. It pushes to further it. By contrast, we can have situations that are regulatory in nature, where there's some amount of self-regulation, for example, and that ends up controlling the infant distress. So here we have a situation where this change triggers a cascading series of changes that kind of push back against that original change, help lessen it, help lessen that distress. And this is very common in our lives. In fact, our ability to stay alive depends critically on homeostasis, this ability to kind of keep in balance. How do you think we live up in Canada when it gets to minus 40? By the way, that's the same in Celsius or Fahrenheit. It's the same thing. And we experience that a couple times a year. And used to be they experience it for solid 4-week periods or something, but now it's the occasional day. And how do you think we survive? Well, it's a thermal regulation. People's your metabolism goes up on days like that. And I bike to work every day, and I'll tell you, when it's really, really cold out, your body responds. So it is with hunger. So it is with thirst. You look at body system after body system, even things like salt regulation that we're barely aware of. There's regulatory feedbacks. There are these systems where if we're short of salt, more commonly we have too much salt, it triggers processes, and that ends up canceling out the imbalance. It pushes back against the imbalance. Very, very common within the physiological and to some degree psychological area. And of course we can put pieces like this together. So that original vicious cycle we saw with infant distress and caregiver distress is enmeshed in a general network. And I could elaborate this further with further aspects of co-regulation, but fundamentally, you're typically going to have a system that's just not simply one feedback, but it's composed of multiple interacting feedbacks that compete at different times as to which is dominant, which is sort of most active. And sometimes, some of these feedbacks may take longer to activate. So initially, there may be a vicious cycle going on, but then, the ability for the caregiver to respond goes up, and then the infant distress is reduced as a result, and things get back into balance. So we have these loops which operate, these feedback loops, some of which are stabilizing, regulatory, bring the system back into balance. We're hungry, we go get food, we become less hungry, but some of which are destabilizing. That's sort of, we've all been in that situation of, we with our partner interacting and we're both tired and both work across purposes, and it kind of goes south for a while. So, you can have these negative feedbacks that help balance out for positive feedbacks. And often we have systems that sort of evolve by the interactions of these feedbacks. So, if we were to look more broadly at the issue of infant mental health, we might see something a little bit more like this. And again, I don't want to pretend that I'm an expert in this area or that I have captured nearly as much richness as should be captured. But, we might start to put together a picture where we have, for example, some underlying system with stress levels and self-regulation and co-regulation through caregivers or in our environment. We also have stress levels as potentially leading to likelihood of maladaptive behavior, which can lead to pushback by others, for example, an intensity of stressors which further increase our stress levels, sort of this feedback here. We might further have factors associated with longer-term developments like buildup of toxic stress, allostatic load, which is associated with the wear and tear on the body due to buildup of stress, development of chronic diseases, which add further to our stressors. It adds further to our burden every day, to the burden on the caregivers who are with us or what have you. And it can build up toxic stress associated with that contribute to our stress levels. So we have these co-regulation mechanisms, we also, though, have components that are subject to intervention. So, for example, screening efforts might decrease the amount of toxic stress within our environment, which lowers the intensity of this loop and makes it less likely that allostatic load will be imposed. We might have training efforts that enhance self-regulatory mechanisms among parents, which further enhance the child's capacity for self-regulation, which both enhance the co-regulation of that child's ability and the ability for the child to increasingly self-regulate as they mature. And as a result, these stabilizing loops involving self-regulation and co-regulation for the child's stress level might help the child's stress level be brought back into more of a balance, be less tipped off, less destabilized and brought into a sort of vicious cycle by these other positive feedback loops. So we can, in short, depict many systems involving sort of health issues and system dynamics using intersections of feedback loops. And what we see in the infant and child mental health area, while I'm no expert at this point, it certainly involves many of these feedbacks at a critical level. And by understanding them and depicting them, even in a diagram like this, you can start to get some real insights. You can start to get insights, for example, as to intervention pathways, which end up having multiple effects. Like, let's say, helping enhance parental self-regulatory mechanism can help co-regulation and self-regulation on the part of a child over time. That's very powerful. So we've used diagrams like this and with some elaborations, for example, in policy briefs where we've suggested certain types of interventions just because they're so strategic when depicted like this. And a model like this is a very high-level depiction of interactions. It's positing sort of a certain structure. The data side is sort of in the background here. There's actually no data linked in these models. We can't run these models, but we can use them to reason at a high level about how things fit together. And sometimes it can help you think through the situation much more fully than if you were just describing it longhand. It kind of lets you see the big picture. And it lets you do that quickly. So these are the sort of models I'll be talking about this afternoon that are especially amenable, really amenable to community contribution, even in a session, where someone can learn how to put together a diagram like this pretty quickly and start to add to it. So I just had the final exam review session. So I left yesterday morning at 5:30 flight for here and out of our city. And the previous night, I'd been up late running an exam review session for my class. My students had never put together these sorts of diagrams before. But, I was able to talk with them, and they were able to put these together and draw the links, connecting things, and put pluses and minuses. It may look a little bit intimidating right now, but believe me, everyone in this room, if we were to take an hour, we could get really comfortable with this. And then there'll be an art you learn for how to create really good diagrams, like how to create diagrams like this that are especially clear, especially crisp, especially sort of transparent and less likely to be ambiguous. That takes some extra time, but everyone could do it. chances are that most of the people you deal with out there in the community are readily able to contribute at this level. So that's a bit of the sort of semi-qualitative. It turns out that, I say semi, ladies and gentlemen, because it turns out that, you notice these pluses and minus signs, these feedbacks. It turns out that each of those types of feedbacks has a certain pattern associated with it, very commonly in terms of the dynamics. So positive feedbacks tend to be associated with divergence. They tend to be associated with instability. Situations where, just like with this microphone and the squeal that would ensue, if I brought a speaker close to it, things get louder and louder and louder and louder, faster and faster. It's like infectious disease. Say if I know in some areas of the States and in some areas of Canada, there's risk of reemergence of some childhood infectious diseases like pertussis and measles. And, you know, if you're in a situation where that gets into an unvaccinated population, it grows by leaps and bounds. One person can infect 3, can infect, you know, each of them can infect another 3, therefore it goes to 9 or 27. It can just grow by leaps and bounds. Whereas, and so these sort of feedbacks are associated with a sort of often exponential rise. And these feedbacks associated with negative feedbacks, for mathematical reasons I don't have time to go into, they're associated with stability and sort of a certain type of stability. And as a result, you can gain often some rough insight as to what dynamics might be expected by this. But you also have to recognize that there's going to be a shifting dominance of these different feedbacks over time that only a quantitative model could emphasize. So what would those quantitative system dynamics models look like? Well, they're composed, ladies and gentlemen, of what we call stocks and flows. Okay? Stocks here represent accumulations. They represent the state of the system, kind of the current status of the system. In many areas in the engineering sciences and physical sciences, we call these state variables. These are things that can be measured at a single instant in time, in contrast to flows, which we'll get to in a minute. And stocks start with some initial value, which you have to specify, and then they're only changed by flows. They're changed by sort of flow in and flow out. And stocks are shown as rectangles in a diagram. So we might have something like this. And again, forgive the crudeness of this diagram, but we have sort of stress levels, and stress leads to buildup of toxic stress, and toxic stress should be connected here to allostatic load. There should be an obvious link here. But that perhaps builds up allostatic load here, which contributes adversely to blood pressure, buildup of blood pressure over time. So adversely affects the ability to regulate blood pressure. So here we might have stocks associated with sort of current levels of stress, allostatic load, this wear and tear that's been built up in blood pressure. Now you'll notice that I highlight these things. I'm not saying, and this is important in these models, it's worth reflecting on. These aren't necessarily immediately observable variables. These aren't necessarily variables that we can directly, immediately observe. We may have ways of estimating allostatic load or stress levels of blood pressure. We certainly do with cuffs. But these, the fact that we're positing this, remember, we're positing how things work out there in the world, and it may be that only certain components of the system we can measure. We can actually go and quantitative collect information on. But here we have these things highlighted, and these are the stocks. They're accumulations. Allostatic load, perhaps most obviously, an accumulation. You build up this wear and tear over time. Stress levels also have some measure of buildup, you know, that really difficult to interchange the racism you experienced. And may build up your stress levels, and there may be some reduction in stress due to a variety of different stress reduction mechanisms. These stocks, they determine the current state of the system. They're central to disequilibria. They're kind of the memory of the system. They give inertia a lot of the time. Even if we were to eliminate the new stress buildup, it'll take some time to. We've all felt it, right? You know, we have the butterflies in the stomach, and they take some time to disappear. We have that tension about something and it disappears over time, but the hormones and the elements of the sympathetic parasympathetic system jointly, they take some time to fully work through elements of these things. Allostatic load will stick with us for long periods of time due to I don't know if it's histone modification or what have you, and blood pressure also takes time to change. So these often give rise to delays. We've done some work in modeling diabetes and end-stage renal disease, and one of the most striking graphs that comes out of it is a graph that shows the costs associated with the end-stage renal disease treatment for the baseline case, kind of the case where sort of things continue on as they currently are, versus a case where we eliminate diabetes. Eliminate diabetes. I mean, can you imagine a bigger dream of the medical profession? The dream of centuries almost. Well, okay, at least of a century. I mean, it's profound, the impact. But the number of ESRD cases and the number of cases associated with or the number of dollars spent in dialysis and so on, continue to rise. How could that be? How could it be that this will continue to rise? Well, we're talking about stopping all new cases of diabetes. There's still those who already have diabetes, and those will continue to develop ESRD for some time, faster than individuals with ESRD will be passing on. And as a result, the number of ESRD cases continue to rise, and we're going to have to care for those with end-stage renal disease for some time from now. So the costs actually continue to rise for quite some time. There's inertia in the system. We're affecting something that's huge, and that's an admirable goal, elimination of all new diabetes cases. But all I'm saying is it doesn't magically change things so that we don't have any spending related to diabetic end-stage renal disease. It's going to play out, and it's going to play out for decades at some form. Let's talk about flows. Flows are the other components of the system, and we show these as kind of these valves here. Turns out that those are the sort of the verbs of the system. Those are sort of what are affecting the system. So you could kind of think of the stocks as the nouns, and these are the verbs. This is where the actions are occurring. So the buildup of new stress, buildup of allostatic load, reduction in stress, buildup associated with blood pressure or change in blood pressure. Flows are sort of where the change occurs in the system, and these are always measured as sort of change per unit time. So it's, for example, in a flow, a literal flow in terms of your bathtub, it's gallons per minute, say, right? We're here in the States, so it's not liters per minute. And as a result, we measure them typically over a certain period of time. And, those of us who work in public health area are probably familiar with lots of flow variables. We talk about incidence, right? We've had 10 cases in the past week with this. That's a flow. It's a thing per unit time. In contrast to, say, the number of people currently in the care of social services, which is some particular number. That's a stock. Okay. So these flows are things that we can depict here. And it turns out there's kind of this dual relationship. Flows dictate change in stocks, and stocks dictate flows. It sounds perhaps circular, but it's not. It's actually very, very well defined. The current state of things, how many people are currently in foster care, determines something about, say, the number of individuals transitioning from foster care. If there's no one under foster care, no one will be leaving foster care. If there's a lot of people under foster care, there's going to be some turnover in that, and it's going to tend to be larger. But flows dictate change in stocks. The number of people under foster care now is going to depend on the number completing and the number coming in. So we have flows dictating stocks and stocks dictating flows, not in a circular way, but in a way that's pretty well defined. So it turns out that with models like this, and I won't go into it, especially given the limited time and interest, but it turns out that models like this are built on a rock-solid foundation of mathematics. And because of that, you can take advantage of all sorts of mechanisms, like mechanisms to analyze. Remember I talked about how the feedbacks of these systems change over time? In other words, If you have a system like this, there's shifting dominance of these feedbacks. Sometimes maybe this feedback will be dominance. Maybe as the child grows, it'll go from being a matter of co-regulation being dominant to self-regulation being dominant. As the caregiver relationship becomes less tight, maybe the child moves out of the home, but in any case, maybe they're older. You're going to have a shift more to dependence on self-regulation. And there are times where some of those adverse feedbacks for certain individual trajectories, some of these adverse feedbacks might be dominant. Think during the teenage years. We have a teenager at home, and I must say that there's occasional exhibition of maladaptive behavior within our home. That's right. So he's a good kid. Occasionally you'll see these, you'll get shifts of these feedbacks, and it turns out that has a very solid mathematical foundation. You can have tools which show you these sort of things. It turns out also because of this, we can take these tools, even a poor model, a model that's created very quickly in a rough and ready fashion, when data's coming in, you can get it to kind of correct for the data coming in. And this is based on some really close interactions with material from what's called computational statistics, which is increasingly being tied in with dynamic modeling. I'm very privileged to have worked with some fantastic bio and sort of more mainline computational statisticians over the years, and have gotten some great insights from them. And one of the things you can do is take a model like this and mesh it with incoming data streams to get it to predict forward, to say evaluate one intervention versus another with great confidence that it's based on the very latest data, and to help compensate for any shortcomings of these models by using that latest data, regrounding it in the evidence. Very exciting stuff, and stuff we're publishing on quite a bit right now, and it's stuff that's very practical, very, very practical in this day and age where we have more and more sort of availability of information in certain scopes. Okay, so system dynamics. Let's talk about some notable scopes of this. So one thing is that you can capture dynamics of continuous variables. The question earlier was about, capturing different types of data, and I mentioned that in general models can incorporate the full spectrum of data, but if you want to capture continuous variables, things like stress levels, things like blood pressure, even things like birth weights or level of strength of glucose response or what have you. These are things that are very useful to capture in a continuous way, and system dynamics stocks and flows tend to be a great way to do that. If you're reasoning about people's regulation of their weight or their body composition, it's a great way to characterize this. You can really quickly pull together a high-level model using these techniques. Causal loop diagrams and even stocks and flows can be pulled together at a rough level very quickly. And it does provide really good support for participatory modeling. There's a whole sub-area of system dynamics, a whole sub-literature about how do you use these models with groups, how to use them to kind of meet with community members and brainstorm about the problems affecting their high school. So Peter Hoffman, I don't know, does anyone here know Peter Hoffman? You folks should know about him. I'm really impressed by his work. He's at the Brown School of Social Work at Washington University in St. Louis. Great guy, very open-minded. I'm privileged to have collaborations with his group. But he's so depending on who you speak to, my engineering colleagues may say I'm an engineer gone bad. I'm not building circuits anymore. I'm not just making computers faster. I'm actually using them to improve something about the world, which I'm proud of. If I'm gone bad, I'm darn well proud of it. But he's another engineer they'd probably say went bad. He got his undergrad degrees, maybe his master's too. It's certainly undergrad in electrical engineering, and then he went on for a PhD in social work. Fascinating guy and a depth of knowledge, and he works a lot with sort of issues at the sort of interface between health and social science and social issues. So be a really good guy to know about. Might be a speaker you could think about, actually. In any case, he does a lot with participatory models with communities. Takes system dynamics into high schools and talks with kids about bullying and the dynamics of bullying. Talks with them about drug use, and you find out all sorts of things. He didn't know that 7-Elevens were this gathering place in St. Louis for actual folks who were doing a little bit of trade with drugs, for example. It was sort of part of the culture there that 7-Elevens were where you hung out for that sort of stuff, and they had no idea of this until they built a model of this. And I'll be this afternoon talking about that modeling process. It's a very, very low weight dependence on computational skills, no programming, and you can do really powerful formal analysis on it. And a strong support for intuition building among a wide variety of people. So that's a little bit about system dynamics. Any questions about that?
Then would you say the negatives are just that you can't run all of the actual empirical data?
No. So it's a great question. I think. Yeah. No. I have some understanding of what you're asking. System dynamics is a bit limited for what you can reason about with data. For example, one thing is it gives you when it's used at an aggregate level, which is most common, though not only the way it's used. But if it's used at an aggregate level, what you get is cross-sectional depictions of a population over time rather than individual trajectories. You can use it at an individual level, but that's really where you get to hybrid modeling, which is what I'm going to be talking about. I mean, hybrid modeling basically allows you to use system dynamics for things system dynamics is really good at, agent-based modeling for things agent-based modeling is good at, and discrete event modeling for things discrete event modeling is good at. It plays to each of their strengths. And really, I'm a big advocate of doing that. But it turns out that system dynamics has also shortcomings in depicting networks. It's very awkward to depict networks in system dynamics. And in general, it's not really good for working with geographic data. So often these days, we're asked to combine our models of GIS data, like where the parks are, where the grocery stores are, where the child care centers are, or what have you. And we want to reason about the accessibility, right? We want to reason about their accessibility to bus routes or what have you. We have this wonderful world-leading community-owned grocery store within our city that filled in for a food desert. And, there's a lot of concerns about getting people there, and we're partners with them. And models that incorporate GIS components are very valuable for these sort of things, but that's very hard to do in a system dynamics model. There's some additional components. I'd be glad to point you to literature on this. But agent-based model, let's talk about this. So what are these agent-based models? That model I showed you first thing this morning, perhaps when you were still asleep, agent-based model. That's an agent-based model. That's the name that it goes by. Now, you'll also hear these referred to sometimes confusingly as micro-simulation models. That's a different tradition within the agent-based modeling area. It comes out of economics, but it's the same basic idea. It's a model of populations composed of individual agents. These individual actors are depicted, and each of them is associated with some characteristics we call parameters. And typically these are things that change, by characteristics I mean things that change less frequently. So things like their gender, their ethnicity, maybe their home location, their birth weight, and maybe income, although you might be interested in income dynamics, changes to income over time. They have state. They have things that are changing over time. Maybe their age, their smoking status, their networks, their preferences. Maybe these things evolve over time, and you're interested in those dynamics. We call those part of their state. I'm not sure how familiar the word state will be and kind of used in that context, meaning kind of the current situation, it's their status, but that's how it's used in this area across the different types of dynamic modeling approaches. And then there's rules for evolving that state. Age is a particularly easy one. How does your age change over time? Well, it changes in a very straightforward way. For each year you're alive more, it's increasing by another year. But then there's other ones that are much tougher. How does your stress level respond? Remember, the model's not a perfect depiction of reality. We're trying to depict, a hypothesis for maybe how things would work, or a kind of caricature of the world that lets us reason through, if it were like this, what would the implications be? Could just these factors explain this data we see? So you might build a model which consciously leaves out a lot just to see whether those things alone could account for some phenomenon. And so your rules for evolving the state might involve some elements, in terms of very simplified rules or more complex rules for how someone's income changes over time, or how their smoking status changes over time based on, various companions that they hang around with, people in their social network who smoke, their parental behavior, smoking restrictions in their community, etc. And so it could be quite involved. And then it means, this is very important, agents are not solitudes. Agents are not depicted in an atomistic way that each evolves independently. That's more of a micro-simulation thing traditionally, but they've even come beyond this. Instead, agents interact with each other critically. The baby interacts with the caregiver. The baby and caregiver are enmeshed in a social support network, so when the caregiver is sick or not available, other people step in. And they may interact with the environment as well. The walkability of the streets affects their ability to engage in physical activity. And that may affect their mental health as well. The model is further associated with some time horizon over which it runs, that was asked before, and some characteristics of individuals. And some characteristics associated potentially with, for example, the spatial environment. And then some initial state. It starts at some point, just like system dynamics and just like discrete event modeling do. Okay, so I want to distinguish this from the sort of system dynamics modeling. So in system dynamics, we divide things up into stocks, and we count the number of people that fall within some category if we're depicting the population as a whole. So we might count the number of people, for example, who are currently in foster care. Whereas in an agent-based model, each individual would be depicted. They might be enmeshed in a network, but each individual will be depicted. Am I in foster care, or I'm living on my own? Am I living at home with family, or what have you? Agent-based modeling is particularly attractive for being able to depict nested context. So I live in a home. The home is in a neighborhood. The neighborhood is in a city, and the city is in a region. And those of you who work in the statistics area will know that for many years now, there's been a lot of emphasis on methods that allow us to reason statistically about these multiple levels. For example, hierarchical linear modeling, structural equation modeling, these sort of models are generative models that reason about what's going on at those different levels and put out data, whereas the statistical models to tease out those effects. Both are super useful, but they do different things. So we might have a model population like this, and each member of that population might be associated with some parameters, ethnicity, sex, income, for example. Each, this is kind of what agenthood is associated with in our model. So each particular agent here would be associated with some particular characteristic. This one, say, an African American who's male and has an income of just short of $64,000. Whereas, another income up here might be a Caucasian male with a lower income up here. So, we'll have this population of agents, and each of them will be associated with certain characteristics. They'll also be associated with certain states. And, example aspects of state here might be include stress levels, aspects of their current age, and its evolution over time, aspects having to do with interaction and co-regulation. These are processes that might be involved in shaping their state within this context. Elements of state might be stress levels, allostatic load that's been built up, whether or not they have a chronic disease, to whom they're connected. Or we might have state associated with whether a person's pregnant or not pregnant, for example. In the infectious disease context, we might divide them into a set of states as to the natural history of some infection. And there might be states associated with respect to sort of care seeking. You'll notice that for a given individual, we can have several of these so-called state charts. We saw these earlier. Do people remember seeing that? It was a buzzing, blooming confusion then. And within a day, it's hard for it to make it less buzzing and less blooming. But suffice it to say that each of these state charts depicts a separate set of concerns for the same person. And so a given person here is going to be in one state with respect to, say, the infection state chart, and with respect to this other state chart having to do with care seeking, they might be in a different state, say, not open to seeking care. They're not inclined to seek care as a general feature. In short, they are male. Here we might have different state charts which depict different sets of concerns. And these are not isolated. These are not truly isolated. They are just, we describe them out of convenience as fairly somewhat independent of each other, but there can be interactions back and forth that can be shown. So, for example, someone's infection status might drive them to be more open to seeking care because they find they have a very serious cough, and therefore they're more likely to present for care because of it. So it's not to say, if you see these like this, it doesn't mean that they don't interact at all. It just means that as a general matter, it's easier to describe them as kind of separate initially, but then we can put links between them on particular sort of situations. So here we have a depiction of a person's state and rules for evolution of it. And you'll notice that there are these various little icons here. And those are associated in any logic with depicting rules for under what situation someone will go from one state to another. So, for example, under what situation someone will go from an effective state to a recovered state. There's certain sort of rules for governing that evolution. But an important component of this is also adding context. And this context, ladies and gentlemen, can be context based on social networks, and such as those shown here. These could be family networks. It could be networks associated with colleagues. They could be intravenous drug use, needle sharing networks. For your different contexts, they'll be different. For the case of infant and child care, an obvious need would be to depict social support networks, interactions, a network that involves close family members, and primary caregivers. So you might depict those as several different networks, and that's what we had in that first model we looked at this morning. So there was a distinguished position of the primary caregiver when compared to these other members of the social support network. So we can have one or more networks, and we can put people in space. We can associate each agent with a particular location. So we have some neat models that depict, our province, and they reason about the roads and going from A to B, for example, and you can do it with bus routes or public transit, how long it would take, and that might affect care seeking and might affect their likelihood of keeping an appointment for a well baby visit or what have you, sort of your likelihood of going there, your distance from that center. So one advantage, one strength of agent-based models is the ability to tap in to that GIS data. You can situate people and you can have their behavior over time be shaped by the availability of geographic resources, et cetera. Very powerful and quite increasingly well-supported sort of way of using these models. Now, in system dynamics models, what we're seeing there is we see the behavior of a model over time. So stress levels, allostatic load, perhaps the blood pressure. We could graph those out over time, say for an individual. But in ABMs, what we're often looking at is patterns not only over time, but over space and over networks. We can kind of see, as environmental contaminants build up, for example, in an area. We were talking this morning about some adverse air quality that you could sometimes experience here, perhaps because of dust on the road. And I know in Western Canada, our neighboring province of Alberta, they have some very serious issues because of fumes from the development of oil and gas industry. And it's really a difficult thing for people with upper respiratory issues. And with ABMs you can depict resource use or contamination. You can depict factors in short that affect or reflect an individual's interaction with their environment. Maybe how much certain care centers are used. You could indicate that visually based on the location of the care centers. This is from a veterinary science model on chronic wasting disease, and those are deer there, are mule deer. And you can also see patterns developing, more stylized models associated with evolution of a population. And sometimes these things can clue you in to big disparities. For example, this in a model, I'll try to give you this one, but there's a model we have of agents and their interactions and their spread of infection between agents. And then when agents get sick, they go to clinic, to nearby located clinics to present for care and undergo care processes. So we can put these individuals, for example, within networks and have individuals evolve. Now, in contrast to system dynamics models, which are typically deterministic, meaning you run them once for a given set of assumptions, you get the same thing exactly. Agent-based models are typically stochastic. Now, that's a fancy term, but what it basically means is that there's chance in the model over time, chance over time. There's probabilities rather than certainty over time. And so generally speaking, you have to run the model many times. We say that we need to put in place a Monte Carlo ensemble. So we run it many times over, and to develop confidence in our interpretation, we'll run it many times over, and we'll use tools of classical statistics, things like hypothesis tests to test the chance that this intervention yielded a statistically significant better result than this other intervention, take into account the variability we see in the results. So I'll very commonly use non-parametric statistical tests for those to whom that's a meaningful statement to compare different interventions. And these stochastics are an asset. Often we'll see patterns in data we get from the real world that are highly variable. And, we've seen cases, it's been fascinating in some of our work, where we've seen data from the world which is broadly indicative, we think, of the trends that we're considering, but there's some aspects of the data in terms of the fluctuations that made us concerned, because, generally speaking, it was rising, but then it would go down for several years and rise again, go down. And we weren't sure if it was consistent with our hypothesis about what was going on. So we put together an ABM. It took less than a morning to put together, which involved, in the ABM, rates were rising. But we used statistics. Just like the statistics we have from the population, we gathered the same sort of statistics from the ABM. These were actually age group-specific statistics, 0 to 4-year-olds, 5 to 9-year-olds. And we used those, and we saw just those sort of decreases and increases from this model. And we know in the model it's increasing, and yet we saw those same statistical patterns. So we figured, okay, that's not, clearly those patterns are not undercutting the hypothesis that it is in fact rising. Those are to be expected when you have age-specific data. Kids age into the age group. If a large group age in now, then a large group will age out later, or it will go down. So in short, sometimes models can be very useful for capturing stochastics. I'll tell you something else too, and I'll share this with you. When I started modeling, I had an unhealthy respect for, almost veneration of data, empirical data. I thought data was just the cat's meow. We need data. And it turned out that I realized and this is not quite a spiritual crisis, but I realized at some point data doesn't actually come from heaven. And there have been 3 or 4 times where we have actually found our model just does not jibe with the data. We found an inconsistency between what the model is showing and what the data is suggesting. And I've not quite rent my hair, but I've been really worried because I thought, there's something missing from this model. Our dynamic hypothesis is not adding up. It's not consistent with evidence. And in these 4 cases I'm remembering, they're not the only cases. There's plenty of cases where I fixed the model and, learned from that experience. It's been a great experience to learn from it. But in these 4 cases, we've actually gone to the people that we've been speaking with and said, look, we can't make sense of this. What's missing from our model? And they've told us, don't worry about it. They said the data got redefined that year, starting that year. They changed the definition, whether kindergartners are included or not included in this definition. Or, those very high TB rates you see that year, that was just someone insisting on a looser definition of what would count as a TB case. So they basically said, well, yeah, it doesn't match up. It shouldn't match up because that data should be ignored. Or, it's been redefined. It's highly questionable. Now, that was interesting because we wouldn't have learned that without the model, actually. We would have taken the data at face value and we would have used it for other purposes if we weren't modeling it in this way. But actually, the model helped point us to a point of learning when it came to data. In many other cases, though, we've been kept honest in the sense that the data pointed us to, okay, this is not jibing with the evidence. We need to go back and rethink some aspects of the modeling. But my point is that data comes with very different pedigrees associated with it. It has very different levels of reliability, very different levels of confidence you can have in it depending where it's coming from. And, there's a lot of cases where it's a bit like the hot dogs that, you can go buy in whatever it is, 7-Eleven. You might not want to know what went into making them in terms of for some data processes. It looks good in terms of just being numbers, but who entered it, under what circumstances they entered it, based on what sort of record keeping. It may be a lot more spotty than you think in terms of its reliability. So models can help us sometimes spot things like this. So what comes out of these ABMs? For a single run, we'll get maybe some gains or some outcomes in terms of number of cases expected in a low SES population or high SES. But if we run it many, many times in these so-called Monte Carlo ensembles, we'll get out histograms that are sampling from distributions associated with these things. In other words, each time we run it, we're getting some particular result, and we run it again and again and again and again. And each time we get a slightly different result, but we'll see some general patterns coming out. For example, here, the number of low SES, number of cases among low SES individuals is far higher than the number of cases among high SES individuals. But in both cases, you can get very low numbers in some cases. In some cases, you have almost none. But here's the sort of distribution with some heavy tail over there. So it's kind of bimodal in its components. So this is what you might get out by running it again and again over time. And this might be sort of a graph over time. So this is over time. This is just summarizing at one point in time. X-axis here being the number of cases, the y-axis being the percentage of times it fell within each of these bins. So this is what we might get out of an ABM. Okay, so that was a little bit on flavor of ABMs. So we have just to sort of rehearse this. We have a population and one or more populations. You can have many populations called meta-population models. Populations can interact. You could have a population of clinics and a population of clinicians and a population of caregivers and a population of children. Or you could have a population of people and clinicians and clinics or what have you. Those will vary by model. Each of those agents, though, will typically have parameters, some state, rules for evolving the state, means of interacting with others, time horizon, initial, and the model as a whole will have a time horizon and an initial state. So a little bit about ABM. Any questions about that before I finish up with the final type of modeling? And for that, I'm going to be opening that model I put on the site just before beginning. Questions on ABMs? I know it's an awful lot. Okay. Yeah.
With what you did this morning with the toxic stress
Yeah.
and the clusters,
Yeah.
you're saying that you could add to that other parameters like
Oh, yeah.
where in their neighborhood are community resources
Totally.
or not.
Totally.
And you could add to that who the people are in the community that are trained in the NRS.
Right. And
You could start to layer on.
precisely.
How much can you layer on these models?
Okay. So I'll tell you. I'll share something with you. Okay. So the ability to build these models and actually build them in a quite transparent way in terms of being able to show them to people and being able to get feedback on them from participatory groups. This has grown by leaps and bounds in recent years. When I started doing agent-based modeling 24 years ago, it was an entirely different world. And you folks would probably have thrown me out of this classroom even sooner, if I'd shown you what we were dealing with there. But now it's grown by leaps and bounds. And it turns out it's at a mechanical level, it's easy to add things in. But the issue is when I say easy, it's fairly straightforward to add things on. The issue is often, you're pursuing a research question, so you want to pursue it in a careful way. And, in these types of approaches, as in some areas of statistics, there are sort of concerns that come in, overfitting, for example, in the statistics context, when you add just variables in. There's some similar sort of motivations for parsimony in terms of not wanting to have so much in your model, because one of the classic, what we call failure modes, classic things that can go wrong in a model like this is it's so flexible, particularly agent-based modeling. It's so flexible that you can add in, all you want until the cows come home. And the problem is that you won't necessarily be adding to your understanding. And so you need to approach it, we'll often in a regression context do stepwise regression, right? We'll sort of add things in a sort of stepwise fashion. And similarly for these models, the best practice is to use them incrementally, to add things in step by step. It helps us learn the effect of adding a new thing. How much of a difference does it make? What sort of difference does it make? How does it contribute to the dynamic? How sensitive is it to this thing? If we just throw everything in up front, we're kind of left with a buzzing, blooming confusion. If we add things in one by one, we gain actually a lot of insight. And often the model you end up with, if you do that, is very different from what you would have thought your endpoint was, because you actually learn from, wow, you mean this one thing can affect all these things? Let's try exploring that more. And you end up going a different route because you've learned. You've learned in that process. Yeah.
So then, because you mentioned stepwise regression, and the idea of bringing things in a lot of time, obviously, when you're looking at systems, you're going to have a lot of things that correlate,
Mm-hmm.
right? And so,
That's right.
how does the model deal with, like, when you have explanations in there, this idea that if you really want to get down to what's making the impact, you sort of have to sort out what's correlated versus otherwise you're doing,
Yeah.
the ultimate ones that could be
Yeah.
one thing that happens.
Yeah. So I'll see if I can address pieces of that. So one of the issues is for a lot of things we observe in the world, there's correlations where the causal structure often makes it, the positive causal structure makes it difficult to tease out exactly what's going on, because particularly for reciprocal causality, right? A affects B and B affects A, and you're trying to figure out, okay, so how how much of the connection is coming in because of this influence via that influence. It's kind of hard to say. It's a chicken and egg sort of thing in a way. And there's been some great advances in the past 15 years in terms of models to try to tease that out. And Judea Pearl's work and the work coming out of Bayesian causal modeling, I think is really interesting in these regards. But for estimating parameters and so on for the model, the things that are going to go in for model assumptions, that's often a tricky component. And sometimes what you end up doing is you end up positing, okay, suppose it were like this, and you run them on, and you see, does it yield results across the different outcomes that are very, very consistent with these, with what you see empirically, associated with those patterns. And so there you're not using the analysis to estimate parameters that go into the model. Rather, you're comparing the model's emergent behavior with this data and adjusting your assumptions accordingly. So that's one way you sort of grapple with these issues of covariation, of correlation between different factors. In general, those correlations, those are reflecting measurements or observations from an underlying set of processes. And really what the modeling is doing is it's talking about those processes. And you're trying to reason about what might those processes be. And the correlation itself, per se, is not a problem for the model, but the problem is it's a problem for identifiability to some degree, sort of figuring out, is it this way or is it that way? It can sometimes be an issue. And sometimes what you can do is with the model, you run it and you say, aha. So it's true, this is a very ambiguous measure, but this other measure would be much more effective, and that would let us tease this out. So I don't know if that's helpful. Yeah. So agent-based models are they're very flexible though, and so you have to be cautious about adding too much in at once, and you pursue it in an incremental fashion. But really what we're talking about, and I'll give a bigger picture for this afternoon, is using these models as learning tools where we learn from them by building them up, right? Again, it's not a failure if a model fails to match evidence in the world. It's an opportunity to learn. You may have heard this term sometimes, fail early, fail often. And it's not saying be, sloppy and just slap happy and do whatever you want. It's saying, be observant as well as try. Try and be observant, learn from it, and modify accordingly. And that's what these models help you do. They help you kind of try out a strategy. Could this be consistent? Observe it more quickly, whether it is consistent with things, and learn from that. So some of the biggest successes for me with my models have been where it doesn't jibe with what I know from the evidence, and so I end up modifying it accordingly. I say I have to account for this factor. I thought I could put that aside, but actually it turns out to be more central. Those are the opportunities to learn that are sometimes brought by these models. And so really we're talking here, Connie, about the model being a companion in learning. It's a companion that helps you have that learning loop. Sometimes my colleague Jeff McDonald talks about double loop learning, sort of learning how to learn more quickly. And it's basically about sort of helping us have continuous improvement in our understanding of the world and what it means at a practical level, and learning from it and being honest, keeping ourselves honest, right? Rather than having cherished prejudices and theories about how things work that are trapped in our head. Yeah.
I'd like to follow up on what you said. Quite often, I listen to news all the time.
Yeah.
And the news will present a model. Actually, correlation as causation.
Mm-hmm.
And then it stops. You know, you think, oh, this causes that.
Yeah. I think, when we work with models, also, we try to avoid the one model to rule them all type phenomena, in the sense that investing in, this is the way it is. Instead, we have a suite of different models that we'll use to probe an issue. And I think that it's kind of incumbent upon all of us, I certainly believe it is for me, to be a skeptical modeler, to, always be, sort of be a little bit skeptical, about about even my best guesses for what's going on. And to have other types of approaches, some of them dynamic modeling, some of them I actually use quite a bit of sort of computational stats and so on, but that kind of cross-check my assumptions. They kind of provide different lenses to kind of look at it, because I think I'm less likely to fool myself then. And I don't want to fool myself, because then I'll be among other things disadvantaging all my colleagues and stakeholders and so on. So I think it really is incumbent upon us to keep our models humble, in the sense of not investing them with overconfidence, but also not to hold them up to inappropriate levels of sort of accolades. You know, not to view them as sort of this crystal ball that's going to yield us in the insights we need going forward. It's going to be an important tool in the toolbox, and it's one that we need to constantly be cross-checking, and we need to approach it as a gain. If we can falsify it or undercut it, we should view that as very attractive, not as something we want to avoid. That's very, very important. It's not a political asset to be protected, that, you know, this model is right and it's the best around. It's rather something that's sort of an invitation to learn, I think. I think it's a very important point. And I agree with you about models. And I have to say, I mean, quite a few, there are some modelers out there who hew more to, you know, I've got the best model around. Our model has been used for countless policy decisions, and it incorporates data from the entire country that no one else has been able to incorporate, and they'll very much be kind of defensive about the model, and that's very dangerous, I think.
That goes back to your analogy about maps, though.
Yeah.
It's like taking a metro system map or something like that, and this is the map of Los Angeles. And you're like, no.
That's right.
This is the map of the metro system.
Right.
And as you said, you don't want a map to get down to the blade of grass, because you really don't have a good idea of what's happening.
That's right.
I think it's better for higher specificity.
That's right. Yeah, and I think there was a training manual for the Norway Army that said, if you're out in the terrain and you're on some exercise or you're in some maneuver or whatever, and there's a disagreement between the map and what you see, believe what you see. So this is part of what's I think incumbent upon models. The last type of modeling, though, I'll speak about here, and I know we have to go for lunch pretty soon. Here is the issue of discrete event modeling, and I actually was not planning to speak about this, and I'm going to have abbreviated comments, both because of the time constraints and because of interest here. But this is a very important type of modeling that I think you folks need to be aware of for service delivery. This type of modeling is less general than system dynamics and agent-based modeling, but it's extremely popular. And actually, if you were to enumerate all the modeling projects using dynamic modeling that have been conducted in health, probably the plurality of them will be with discrete event modeling. Oh, sorry? Yeah. Oh, okay. So you're very familiar with it. Yeah. That's right. It's very sort of circumscribed, and it depicts processes in terms of the flow of entities. In this case, it might be cases or patients or what have you, through a set of defined processes, often defined in many ways linearly, although they can have branches and sometimes loops, but it's very well defined how they proceed. So you can imagine someone being taken in. In this case, I think we do a lot of work for our Ministry of Health, which is patient flow for the entire patients through the medical system, but there's a special interest in emergency care because that it gets up impacted by strength of home care and long-term care facility needs, et cetera. And, people come in and they determine if a CAT scan is needed. Wish we were taller. Wish we had Air Jordan or something. Whether a CAT scan is needed, and if so, they undergo a CAT scan, otherwise VQ scanner and ultrasound, et cetera. And they're put through these processes. And there's these well-defined operators that sort of are used to build up these models. They're quite transparent. Lots of people can understand them. They're quite accessible. And the key thing here is that we're describing the processes that operate upon the entities. So here, the people who flow through it, say people, so cases or patients or what have you, those individuals are viewed more passively from this sense. They kind of flow through it, and they're operated upon by these processes, by these gating procedures. And those gating procedures, critically, and this is getting to the kicker with it, those are made possible by availability of resources. So, for example, there might need to be a caseworker to take them from this stage to another stage. There might need to be a diagnostic machine available to diagnose them, with this ailment. There might need to be some sort of step in terms of IT entry that's needed to get their case into the system or what have you. And so these things take time because resources are limited, is the idea that, there needs to be someone who enters that information. There needs to be someone who, in other words, who's free, who's not taken away by other duties to now enter that information. There needs to be that clinician available to meet with the person, et cetera. So these types of models are extremely useful for reasoning for very defined processes in the context of the shortage of resources. If you only have so much in the way of resources, and we need to figure out, do we add caseworkers, or do we put that money into co-locating a facility or opening a new facility, should we hire more caseworkers? Should we get a better IT system? These sort of models can be quite useful for sort of reasoning how much would it help to invest in these resources? Would it help a lot, or would it just shift the bottleneck to somewhere else? And sometimes you find that. You invest here, it's just like squeezing the balloon. You squeeze here, pops out over there. You squeeze there, pops out over there. And so what these models capture is queuing. They capture the fact there's waiting times associated with things. If the resources aren't available, you wait. And really, that's the only interaction between these people who flow through the system here. The people who flow through the system are viewed kind of passively, and they wait, and sometimes they balk and they leave, but they don't interact with each other. There's little in the way of kind of people interacting with each other, exchange of attitudes, knowledge, attitudes, beliefs, or what have you. And very defined flow paths here. So, this does allow you to represent defined sort of processing and very defined pathways in the context of limited resources. You can use it to identify impact on health service delivery or waiting time, the throughput of or waiting times associated with processes for certain levels of resources, for placement of resources. Often we have it mapped out in space, and you say, well, if we had this certain pill cart that could be available on this floor separately from that one, how much would that speed things up? It helps us reason about resource coordination and comparatively low reliance on computational skills compared to agent-based modeling. So we've done a fair bit of work with this, but this is the kicker here. I'll talk about social network this afternoon. The best uses of a lot of these models, and I couldn't have said this 10 years ago. I'm not sure if I could have said it 7 years ago in a serious way. The best uses of these types of models, system dynamics, agent-based, discrete event, is together. It's combining them together in a hybrid way. It's actually, now we have the ability to use discrete event modeling for just one piece of our model. For example, the clinic component. We can use system dynamics modeling for one piece of our model where we don't need that much heterogeneity represented. We don't need to represent the networks of people. And we use ABM where we need to represent networks and heterogeneity, people's differences, where we need to represent individual persons' histories or what have you. So often now we are complementing these approaches. And you have some very powerful complementary sort of uses of these approaches. And one of them I want to highlight for you. I would never recommend DES as the main method to use in this area, but complemented with agent-based model, for example, it can be very powerful. So you have individuals, they present for care, they're being handled by processes while still being represented in their networks, in their interactions with each other, et cetera. And you can do very, very powerful things. So, for example, we could look at the placement of clinics within a population. These are populations of agents, and these are clinics, and each clinic can have in it, for example, this is a trivially simple representation, a representation of the flow process. You could do this for care, for the caseworker processes, the processes associated with gating people through the system for social services, or for that address the delivery of services for people with intellectual disabilities or people with mental health issues. You can actually represent the process of service delivery at the same time you represent them as individuals within the population. These individuals can be associated with networks and associated with interactions, with these rules and these characteristics and state, but they can go through processes as well. So this, I think, is a very attractive approach when you have key issues that cross between the micro level interactions between individuals, and you also have issues that have to do with those care deliveries in those 5 sectors, things like child welfare, things like treatment of individuals for mental health issues, things like educational concerns. We can represent the care processes and an individual's sort of progress through the care processes at the same time as they're represented as a full individual with respect to their interactions and their history and trajectory. And we're not limiting their representation to this very defined care process. Instead, they can be circulated as agents. So the model I put out there, and we don't have time to go run it now, although I'll be glad to do so after lunch. The model that I put out there on the site actually involves exactly this sort of situation. So you have individuals who are in the population as agents, and they present for care, and they undergo care processes while still being full agents. So this sort of hybrid modeling, very powerful. And the final type of hybrid model I'll just mention, I already showed to you this morning, so I don't even have to show you a new model, and that is this one. I may have passed it by you a little bit on the slide, but you know, emphasizing it now, what we see here is actually a hybrid model. We see components that are associated with agent-based modeling, these sort of state charts, for example, here, the placement of individuals and networks of connections. But here we actually see a system dynamics diagram. This is this software's way of representing stocks, stress, and flows, new stressors, and so on. So here we actually have each individual have a system dynamics diagram which is governing some of their interactions, and they're also evolving according to state charts. So this is actually a hybrid model combining agent-based modeling with system dynamics in a very powerful sort of a way that's very powerful in general to combine the two. Represent the continuous dynamics with system dynamics where there's that theory behind them, and then represent other components with state charts and other sort of events and other more classic agent-based mechanisms, putting people in networks, giving them situated locations and GIS space, etc. Okay, so I've kept you, I'm standing between you and lunch, and I'm glad you haven't tossed me out yet. So apologies for keeping you somewhat over, but we will resume in an hour's time. Is that right?
In an hour, yes, 12:15. Okay? 1:15.
1:15.
1:15.
Yeah.
It'll be crowded and most of one spot, so you need an hour.
Great.
Okay? So we are headed over to the little strip center right by the Starbucks because there is a Deleterious there. There's Dunpeppy right behind it. There's Jasmine Garden right next to it. There's lots right there in that